Your sexual health isn't something to ignore, yet millions of people are overlooking these 7 critical red flags. If you've ever experienced low morning energy and no morning erections, mood swings and sudden irritability, reduced sensitivity, or longer recovery time after intimacy, you need to watch this right now. But here's the truth. Your body often whispers before it screams. But today, we're cutting through the noise with facts, no fluff, just actionable advice to empower you. I'm revealing 7 subtle signs you're ignoring that could be warning you of a deeper sexual health issue. And for each one, I'll bust the biggest myth you've probably heard. Myths that could be putting your health and relationships at risk. Stick around because sign number 6 is the one even doctors sometimes miss, and it could save your sex life. Because some of the biggest red flags are so sneaky, you could be ignoring them every single day. And by the time you notice, it might already be affecting your confidence, your relationships, and even your long-term health. If you've been telling yourself, that's just part of aging, or that happens to everyone, this video might change your mind, and potentially your life. I'm Dickerman, and for over a decade, I've studied men's and women's health, working with medical experts, nutritionists, and wellness coaches. I've helped thousands of people improve their sexual health naturally, and I can tell you, the earlier you recognize these signs, the faster you can turn things around. So let's start with the first sign you're probably ignoring right now. Sign number 1, low morning energy and no morning erections. You wake up feeling tired, sluggish, and without the usual morning signal from your body. You might brush it off as bad sleep or stress, but it's actually one of the earliest signs that your hormone levels could be out of balance. The myth: morning erections are only about desire. Wrong. They're actually a vital health check your body performs overnight, linked to blood flow and testosterone levels. If they're suddenly gone, it's your body whispering, hey, something's off. Why it matters. Poor morning function often points to early cardiovascular issues or low testosterone, both of which can snowball into serious sexual health problems if ignored. But what if these subtle 7 signs of hidden sexual health problems aren't just normal, but warning signs of a deeper sexual health problem brewing beneath the surface? Problems that, if ignored, could lead to infertility, heart disease, or even life-threatening complications. Sign number 2. Mood swings and sudden irritability. You notice you're snapping at your partner over small things, or feeling unmotivated for no reason. This isn't just stress. Mood swings are closely tied to changes in sex hormones. The myth: mood swings are just part of midlife or PMS. Not always. Men and women both have delicate hormonal rhythms that can be disrupted by poor diet, lack of sleep, or underlying health issues. And one of the first systems to feel the impact: your sexual health. Why it matters. Unchecked mood swings can create relationship tension, lower desire, and mask deeper issues like thyroid imbalances or chronic inflammation. Moving to next sign. Emotionally, this creates a vicious cycle. Fatigue leads to avoidance, breeding guilt and isolation. A study in psychosomatic medicine found it increases breakup rates by 40%. Tip: get a full blood workup for iron, thyroid, and vitamins. Incorporate 7 to 9 hours of sleep and mindfulness apps. Research shows meditation cuts fatigue by 30%. Reclaim your energy. It's the foundation of a fulfilling sex life. Sign number 3, reduced sensitivity. You might notice you're not as responsive as you used to be, whether that's physical touch or intimate connection. This isn't in your head. It's often a blood flow issue. The myth: sensitivity naturally declines with age. Nothing you can do. That's outdated thinking. Yes, circulation changes over time, but lifestyle, diet, and even stress can speed up or slow down that decline. Why it matters. Poor circulation doesn't just affect sensitivity. It can be an early sign of atherosclerosis or nerve damage. Catching it now can prevent bigger problems later. Sign number 4, sudden changes in libido. Your desire has dropped, or maybe it's spiked suddenly, and you can't figure out why. Changes in libido often come down to more than just stress or attraction. The myth: libido is purely mental. It's all about attraction. Actually, libido is a complex cocktail of hormones, neurotransmitters, and physical health. When your desire changes unexpectedly, your body might be waving a red flag about nutrient deficiencies, hormone imbalances, or even sleep quality. Why it matters. Ignoring shifts in libido can delay treatment for underlying conditions, from anemia to depression to metabolic issues. You might think, I'm just busy, or it's the hormones, and ignore it. But research from the Cleveland Clinic shows low libido affects up to 40% of adults and can signal underlying issues like hormonal imbalances, thyroid disorders, or even depression. Emotionally, this can trigger feelings of inadequacy or strain relationships. I've seen couples drift apart because one partner felt broken. The science? A study in the Journal of Sexual Medicine found that ignored libido changes increase anxiety by 30%. Sign number 5. Longer recovery time after intimacy. You used to bounce back quickly. Now it takes hours, maybe days, before you feel ready again. That delay is often tied to cardiovascular fitness and hormone levels. The myth, recovery slows with age, nothing can change it. That's not entirely true. While age plays a role, factors like nutrition, exercise, and sleep have a huge impact on recovery speed. Why it matters. A long recovery window can point to poor stamina, circulation issues, or adrenal fatigue, all of which affect overall health. Sign number 6. Unexplained weight gain around the midsection. Your waistline is growing, even though your diet hasn't changed. This isn't just about looks. Abdominal fat is closely linked to hormonal changes that affect sexual health. The myth. Gaining belly fat is just part of getting older. Not necessarily. Belly fat is metabolically active and produces chemicals that can lower testosterone and estrogen levels, directly impacting sexual function. Why it matters. It's both a symptom and a cause, and addressing it can dramatically improve your sexual health and energy levels. Last but crucial, sign number 7, sleep problems. You're tossing, turning, or waking up tired. Sleep issues can quickly disrupt hormone production, especially the hormones tied to sexual function. The myth. Sleep problems don't have much to do with intimacy. They're deeply connected. Testosterone, for example, is produced in deep sleep, and poor rest can lower it dramatically in just a few days. Why it matters. Fixing sleep is one of the fastest ways to boost sexual health naturally. Now that you know the 7 hidden signs and the myths holding people back, what should you actually do about it? Let's talk solutions. The 3 powerful steps to turn things around. 1. Get a full health check. Don't just test hormones. Check cardiovascular health, nutrient levels, and inflammation markers. 2. Upgrade circulation. Daily movement, resistance training, and nitric oxide boosting foods like beets, pomegranate, and leafy greens work wonders. 3. Balance your hormones. Naturally, focus on sleep, stress reduction, and nutrient-dense foods. Avoid crash diets or extreme routines. They often make things worse. Tip. Track your mood and energy for a week. If it's persistent, get a hormone panel blood test. Start with lifestyle fixes like 30 minutes of daily exercise. Research shows it boosts testosterone by 15%, and consider therapy for psychological roots. Don't let this erode your self-worth. Addressing it early restores intimacy and vitality. Key takeaway. Sexual health isn't just about intimacy, it's a mirror of your overall health. If you spot any of these 7 signs, don't brush them off. The earlier you act, the better your chances of restoring your energy, your confidence, and your relationships. Erectile difficulties or trouble getting aroused. Guys, if you're brushing off occasional performance issues as fatigue or alcohol, listen up. This is a classic hidden red flag. According to CBC News reporting on medical research, erectile dysfunction, ED, is an early indicator of heart disease in nearly 60% of cases, often appearing years before a heart attack. There you have it, the 7 hidden signs: libido changes, arousal issues, pain during sex, unusual discharge, urinary problems, fatigue, mood swings, and skin changes. Ignoring them isn't just risky, it robs you of joy, connection, and health. But the good news? Before we wrap up, I want to share a critical resource. If you're concerned about sexual health or performance, there's a powerful, natural solution you need to know about. It's a 7-second home remedy that addresses the root cause of many male performance issues. No pills, no gimmicks. Check the pinned comment below to watch a free video that explains it all. Open it in a new tab and watch it right after this video. Trust me, it's a game changer. If this video helped you, hit the like button, share it with someone who needs to hear this, and subscribe for more science-backed tips to keep your body and your life vibrant and active. All content is for educational purposes and provided with input from medical professionals. Always consult your healthcare provider for advice tailored to your personal needs.